Premature ejaculation, P, is a widespread sexual health concern that impacts men of all ages, often causing significant distress. It is defined as ejaculation that happens either before or shortly after penetration, with little to no control over timing. This condition can stem from a variety of factors, including psychological triggers like anxiety, stress, or past traumatic experiences, as well as biological causes such as hormonal imbalances or heightened penile sensitivity. Men experiencing PE may feel frustration, embarrassment, or even shame, which can further exacerbate the issue. Relationships may also suffer, as partners might feel unsatisfied or disconnected. Despite its challenges, premature ejaculation is treatable, and understanding its root causes is the first step toward effective management. Temporary factors, such as performance pressure or situational stress, might resolve on their own, but persistent cases often require a more structured approach. Medical professionals highlight the importance of open communication between partners and seeking expert guidance to address the condition holistically. By identifying whether the cause is psychological, physical, or a combination of both, individuals can explore tailored solutions to improve sexual health and overall well-being. Recognizing PE as a manageable condition, rather than a permanent limitation, empowers men to take proactive steps toward lasting improvement. 2. Scientific research indicates that some cases of premature ejaculation may resolve naturally, especially when linked to temporary stressors or situational anxiety. Studies show that young men, in particular, often experience improvements as they gain sexual experience and confidence. However, chronic PE, persisting for 6 months or longer, typically requires targeted interventions. Data suggests that spontaneous recovery is less likely in these cases, making proactive strategies essential. Lifestyle factors such as regular exercise, stress management, and healthy sleep patterns can contribute to better ejaculatory control by balancing hormones and reducing anxiety. Medical experts also note that relationship dynamics play a role. Supportive partners can alleviate pressure, which may indirectly improve symptoms. Nevertheless, relying solely on self-resolution is not always effective, especially for men with underlying anatomical or neurological conditions. Research underscores the importance of evidence-based approaches, including behavioral techniques, medical treatments, or therapy, depending on individual needs. While some men see improvements without formal treatment, consulting a healthcare provider ensures a structured and effective plan tailored to the specific causes behind the condition. 2. For those seeking evidence-based solutions, several proven methods can help manage premature ejaculation. The stop-start technique involves pausing stimulation when nearing climax and resuming after the urge subsides, training the body to delay ejaculation over time. Pelvic floor exercises, such as Kegels, strengthen the muscles involved in ejaculatory control, enhancing endurance. Topical anesthetics, numbing creams or sprays can reduce sensitivity, while psychotherapy addresses psychological barriers like anxiety or past trauma. In some cases, doctors may prescribe SSRIs, medications that delay ejaculation as a side effect. A personalized approach is critical, as what works for one individual may not suit another. Combining multiple strategies, such as behavioral exercises with stress reduction techniques, often yields the best results. Consulting a urologist or sexual health specialist ensures proper diagnosis and a tailored plan. By incorporating these evidence-based methods, men can regain control, improve sexual satisfaction, and strengthen intimate relationships. The key lies in persistence, open communication, and professional guidance to achieve long-term success. Research indicates that premature ejaculation can sometimes resolve on its own, especially when triggered by short-term factors like stress, anxiety, or inexperience. Studies show that men experiencing occasional episodes due to situational stressors may see improvement as their emotional state stabilizes. For instance, performance anxiety, often tied to new relationships or pressure to please a partner, can diminish with time as confidence grows. However, spontaneous resolution is less likely in chronic cases where underlying physiological or psychological issues persist. Scientific data highlights that lifestyle adjustments, such as regular exercise, stress management techniques, and improved sleep, can positively impact sexual health. Moderate physical activity, for example, has been linked to better pelvic floor control and reduced anxiety. Additionally, mindfulness practices like meditation or deep breathing may help men regain control over their arousal levels. While these changes aren't a guaranteed cure, they contribute to overall well-being, which can indirectly alleviate symptoms. Yet, reliance on self-resolution alone isn't advisable for persistent cases. Long-term premature ejaculation often stems from deeper causes, such as hormonal imbalances or neurological factors, requiring professional intervention. Men noticing little to no improvement over time should seek medical advice to explore targeted treatments. Understanding the distinction between temporary and chronic cases is key to choosing the right path forward. Premature ejaculation can be effectively managed through several evidence-based approaches. One widely recommended behavioral technique is the stop-start method, which involves stimulating the penis until the point of near ejaculation, then pausing to allow the urge to subside before resuming. Over time, this trains the body to delay ejaculation. Similarly, pelvic floor exercises, such as Kegels, strengthen the muscles controlling ejaculation, improving sexual stamina. Consistent practice is essential for noticeable results. Topical anesthetics, like lidocaine sprays or creams, temporarily reduce penile sensitivity, prolonging intercourse. These should be used cautiously to avoid transferring the numbing effect to a partner. Psychotherapy, particularly cognitive behavioral therapy, CBT, addresses psychological contributors like anxiety or negative thought patterns. A therapist can help reframe unhelpful beliefs and improve confidence during sexual activity. Medication such as selective serotonin reuptake inhibitors, SSRIs, is another proven option. SSRIs, which are commonly prescribed for depression, can also delay ejaculation as a side effect. However, they should only be used under medical supervision due to potential side effects. Each of these methods has varying effectiveness depending on the individual, so consulting a healthcare professional ensures a personalized treatment plan for optimal outcomes.